Hi guys, it's Dr. Sabrina Siegel and welcome to Brain Myth Monday. Today I'm going to be talking about pregnancy brain. And what's interesting about this particular brain myth is that there's actually quite a bit of truth to it. So researchers have known for several years now that there are certain brain changes that occur throughout pregnancy. In a recent study, researchers examined the brains of 9 pregnant women before and after delivery. They scanned these women's brains before delivery and then 6 weeks post-delivery, 6 months, and for some of them they were able to scan their brains up to a year later. What they found was a significant decrease in overall brain volume, and in conjunction with that decrease in brain size, they found a significant increase in these women's ventricles. What are ventricles? You have 4 of them in your brain, and on a brain scan, they just look like holes. They are far from holes, but they are spaces in your brain that have a very important function, which is producing and circulating your cerebral spinal fluid, or CSF. And it gets circulated through the spinal cord and throughout the brain. So there's speculation as to what causes this, but we do know that the changes begin to occur at the point of placental implantation, and then the decrease in brain size reaches the maximum point when the woman is at full term. Then once the woman has delivered, the brain size slowly returns back to normal. And so on average, brain sizes return to normal by 6 months. For some women, it's a little bit earlier, but on average, about 6 months. Like I said, there's some speculations about what changes occur throughout pregnancy that could impact the volume of your brain. Most scientists think that this has to do with changes in hormones and metabolic functions to support the growth of this new life. And there are actually quite a bit of other biological changes, as I'm sure most of you know, but there's organ enlargement of the heart, the kidney, and thyroid gland as well. So the brain isn't the only organ that's affected by pregnancy. But there you have it. There really is some truth to this brain myth. And so if you are pregnant or if you're thinking about getting pregnant, just keep that in mind. As your body and your brain is adjusting to this pregnancy, you may have some cognitive difficulties, and so please be nice to pregnant women while they are going through this journey. What's really interesting is in this study, there was no difference between whether or not the women chose to breastfeed or not in terms of the brain size returning to normal after delivery. So just keep that in mind, that every single woman followed a similar time course in terms of their brain sizes returning to normal. So that's it for today's Brain Myth Monday, and I really hope you've enjoyed this episode. I'm actually going to be addressing a lot more about this topic and go into a lot more depth. I try to keep these videos short, but I will be talking about also preeclampsia, which is a condition during pregnancy where blood pressure is elevated and sometimes you have some kidney dysfunction. So I'm going to talk about brain volume with preeclampsia in my blog, as well as going a little bit more into depth on the topic that I addressed today. Thanks so much for tuning in to Brain Myth Monday, and for more information on exercise in the brain, you can go to www.drsabrinasiegel.com. And if you need to find motivation to exercise, I encourage you to check out my free ebook, which you can find on my website. Thanks so much. I'll see you next time.